hope. It is a word never used for children diagnosed with a rare disorder called SMA. Until now. Health Canada has just approved a new drug that shows stunning promise. And tonight I have the story of a little girl who needs that drug, but no one can say if or when she will get it.
Ring, ring. Yes, Giant. We have a big problem.
Sophia is 3 years old and has a big imagination. She also has SMA, spinal muscular atrophy, a rare genetic disorder that slowly destroys all the muscles in her body. And it is starting to take hold.
Are you a pirate? Whoopsie.
Each fall shatters her parents' hearts a little more.
Right now she is starting to notice, so she has days where she can't get up on her own off the floor. So she's even said, "Mommy, I'm broken."
But for the very first time, Sophia's parents have hope almost in their grasp. Health Canada has just approved the only drug proven to stave off SMA, Spinraza, a miracle in a vial for desperate families. Clinical trials show it can halt muscle damage and in some cases even reverse the devastating effects. This video posted on an SMA website shows a child who couldn't walk or even sit up before taking Spinraza, now taking steps. But with the drug's approval comes an even bigger hurdle, the cost. In the U.S., Spinraza is $750,000 for the first year of injections, and then $375,000 after that, every year. For life. Each province has to decide if they will cover it, but that takes time. Canada doesn't have a rare disease strategy that could expedite the process. Sophia's parents may have to wait up to a year and a half before finding out if OHIP will cover the drug. Doctors have told them Sophia may be in a wheelchair by then.
They need to start the treatment right away. It's like waiting for chemotherapy another year.
Sophia's parents hope she can get the drug so she can continue to walk. For 17-year-old Hayden McIntyre, who has a more severe type of SMA, the hope is he will be able to keep the tiny, precious movement he has in 5 of his fingers, so he can still use his computer, his lifeline to the world. Hayden has had 4 doses of Spinraza through an expanded access program, but no one can say if he will continue to receive it. Even though his parents haven't seen an improvement yet, Spinraza gives them hope. They, too, are waiting to see if the drug will be covered.
Now, Spinraza will next be evaluated by the Canadian Drug Expert Committee, and then a recommendation will be made on whether joint negotiations should be made with Biogen, which is the manufacturer of Spinraza, to try and bring the price of the drug down. Until then, families have little choice but to wait and hope. And that story came to us from a viewer tip. If you have a story to share with us, here are all the ways you can contact us.